And here is your question. Right. So if you have read and understood, considering it surgical anatomy station, kindly please tell me if you can identify what region are we looking at?
We're looking to the right shoulder, to the brachial plexus.
Brachial plexus. Can you please tell me how brachial plexus are formed?
Okay, it's from nerve from C5 to T1.
Yes.
This is make a root, and after this trunks, after the trunks, it will be a division. This division from anterior and the posterior, the posterior all division continues the posterior cord, and the anterior for lateral and the upper and medial will make the lateral cord, and finally the anterior division of the medial make it the medial cord. After this, after the cord, it will be the terminal nerve.
Can you name the branches which arise from the roots of the brachial plexus?
Yes, okay. It will be nerve 2 rhomboidus, nerve 2 subclavius, nerve 2 scalenus muscle.
From the roots, how many branches are there?
There are 3.
Okay.
Serratus anterior.
Subclavius, yes. Nerve 2, long thoracic nerve, and then there is third one, dorsal scapular nerve.
Yes, dorsal scapular nerve.
All right. Can you tell me how many cords there are?
There are 3 cords.
Yes.
The medial cord, lateral cord, posterior cord.
All right. In this diagram, if you can kindly identify this number D.
Number D is musculoskeletal, musculocutaneous nerve to biceps.
Yes. Okay, and then E, please.
E, it will be the, I don't know E.
Could that be axillary nerve?
Axillary nerve.
What is the dermatome of axillary nerve?
C5, C6.
It supplies which muscles?
Teres deltoid and teres major.
Minor.
Teres minor, yes.
Yes, all right. If you can please kindly identify number C, please.
C, it's ulnar nerve.
It's, yes, very good. And F, please.
F, it will be the radial.
Medial root of median nerve. All right. Okay. If you can tell me, what are you looking at here in picture C?
I look to the shoulder joint from
very good.
Behind.
How
behind.
Yes, shoulder girdle is formed?
It's formed from the acromion end of the clavicle and the acromion process of the spine articulate together and make the shoulder with the head of humerus to the glenoid cavity of the scapula. All right.
Can you tell me what are the structures which strengthen the shoulder girdle or the shoulder?
Okay, the muscle around the scapula, and there are ligament.
Yes.
There are the capsule and deep fascia.
Yes. Where
Uh,
shoulder joint is most weakest?
Sorry?
Where shoulder joint is weak?
Yes, it's from
Or-
anterior part.
No. Posterior. Okay, right. If you can identify number 2 over here in picture A, please.
2, it's acromion process of the scapula.
Yes, acromion. If you can identify number 15 over here, please.
15, suprascapular fossa.
Supraspinous fossa.
Supraspinous fossa.
Attaches here, number 15.
Supraspinatus muscle.
All right. If you can please identify number 5.
Infraspinatus fossa.
Yes. If you can identify number 11, please, in picture B.
Subscapular fossa.
Yes. All right. If you can tell me what are the structures which are attached to the coracoid process and which one is coracoid process? If you can identify it first.
I can identify the coracoid process at 1 centimeter below the middle clavicle
Yes.
between and it will be
Number 3.
yes, number 3, and
Right.
they're attached to its origin of pectoralis major and for sorry, it has attachment for pectoralis major and for pectoralis minor.
Yes.
And for ligament, it will be coracoid, coracohumeral ligament, coracoacromial ligament, and
Clavicular.
clavicular ligament.
All right.
Yes.
Okay. Can you please tell me what are the muscles which are included or which are included or called as rotator cuff muscles?
Yes, it will be supraspinatus muscle, infraspinatus, and teres minor, and subscapular muscle.
Yes. Okay. Can you please tell me the origin and insertion of infraspinatus muscle?
Okay, infraspinatus from infraspinous fossa of the scapula.
Yes.
The origin and insertion it will be in greater trochanter of the humerus.
All right. Okay. Can you tell me what are other muscles which are inserted into the bicipital groove of the humerus?
Okay, it will be from medial to lateral. It will
Yes.
be teres major, latissimus dorsi, and pectoralis major.
Yes, very good. Can you please tell me what are the factors which decrease you told me kind of. Okay, can you tell me the boundaries of the quadrangular space and also tell me where exactly is it located?
Okay, the boundary it will be the long head of triceps. This it will be the lateral. Sorry, it will be a medial, and humerus it will be the lateral, and the teres minor from superior and inferior teres major. What's the second part of the question?
Where exactly is it located? If you
It's
can.
located in the back of the shoulder, between the lateral part of the scapula.
Can you tell me what are the contents of the quadrangular space?
Okay, it will be the axillary nerve and posterior circumflex femoral artery.
Humeral vessels, vein as well. Okay,
Yes.
right, good. Right, one more. Bell has gone back. Okay, what kind of image are you looking at?
I'm looking to arthrogram
Yes.
picture
Can you
of the shoulder.
identify which shoulder, maybe?
This is right shoulder.
Okay. Can you identify the structures which are encircled blue?
Okay, number 6.
One.
It's
Okay, 6.
one. Okay, one it's acromion process. 4
Yes.
it's a clavicle.
Okay. And 5,
Uh,
please.
5 it's deltoid,
Very
and
good. Can you
6
identify? Yes, 6, please.
labrium of the glenoid cavity.
Glenoid cavity. 7 is
Yes.
labrum.
Okay.
Okay. If you can identify 10, please. What is this pointing at?
Supraspinatus tendon.
Yes, very good. Can you give me some indications? In which conditions would you ask for this imaging?
If there are shoulder impingement, frozen shoulder, if there are any osteoarthritis, any inflammation of muscles, myositis or inflammation in ligament.
Yes, good. Okay, I think that was the last one. Good. Thank you. Before we end, can you, because we started off with brachial
Yes.
plexus, can you tell me the complications of brachial plexus, especially if a child is born as a breech, what kind of with what kind of brachial plexus complications or damages it would be born?
It might have attraction lesion. It will be a clumps palsy or Erb's palsy.
What is the difference between Erb's palsy and Klumpig's paralysis?
Okay, the difference it will be in Erb's it will affect the upper cord, C5, C6, and in
Yes.
clumps it will be from C8 and T1, the lower cord.
And in symptoms, if you can tell me?
Yes, okay, the symptoms it will be the arm adducted and the shoulder internally rotated and the forearm is pronated.
Yes.
And the wrist is flexed backward, and he lost the sensation of the medial arm and forearm. Okay,
Yes.
and clumps it will be hyperextension of metacarpopharyngeal joint.
Yes.
With flexion of proximal interpharyngeal joint and extension of distal interpharyngeal joint of the hand.
If you can just imagine a situation, a person is climbing a tree or maybe getting down his cat from the tree, and he's trying to reach out for one branch onto which cat is sitting. So he all of a sudden he's stretching out for the branch when he falls down. What kind of brachial injury he is susceptible of having?
Erb's palsy?
No. Or why? You have to think and tell me.
Because he fall on his upper shoulder.
Yes, and he was trying to reach out for the branch. So what kind of injury he's susceptible of having? You have to think and imagine.
Okay, so it will be